Hello everyone, I'm Dr. Jim Daly from Daly Manufacturing, and we'll be talking to you this week about immune support and particularly beta glucan. That's going to be the main focus of the day's talk. And I'm glad everyone's here. We're geared up for the fall season right now, and I think with school starting, this is a very timely topic. So I hope that everybody is ready to put on their thinking cap, so to speak, and try to learn a little bit, because part of this is going to be a little difficult because it's getting into real immunology. Now, part of it I'm speaking, and part of it is going to be handled by Dr. Donald Cox, who's an immunologist that did research on beta glucan, and particularly it's used in children. Last summer, he and I both videotaped sessions on beta glucan, and particularly our new product Beta Kids. And this is going to be his part of it today, is going to be his part of that session. I did another session talking about vitamin D and immunity, and we may show that one sometime too. But this is about beta glucan, which is a really core immune enhancing product. Now, we will go on to our first slide, and you can see here that there are a lot of different kinds of immune cells, and it's just three of them. The one you see over here is a erythrocyte or red blood cell, and that's the ones that when we don't get enough iron, they can't carry oxygen, so we become anemic. This actually looks a little bit different, but that's a platelet. I'm not used to seeing platelets look like that, but that's what that is. And this over here is a T lymphocyte. That's the kind of white blood cell that's an immune cell, and very important one. That's the kind of immune cell that runs into problems with the HIV virus, for instance, and it destroys them. And that really shuts down the immunity, and that's why people with AIDS don't have good immune systems. Now, the immune system is pretty complex, but this is a substance that the beta 1,3,1,6-D glucan, or glucan I usually call it, is a polysaccharide that is an immune stimulant. Well, not really immune stimulant. Immune enhancer is a better word, and I'll explain why in just a minute. Now, you can look at this and you can see all this long chain of glucose molecules. And beta glucan is hooked together in such a way that our digestive enzymes don't digest it, just like cellulose and your fibers. But this one is a beta 1,3 linkage here with the 1 and the 3, 1, 3 type linkage. And every now and then, there's a branching off, and it's a 1,6. You can see right here, it branches off. This would be the 6 position over to the 1 position on that glucose. So that's how it branches. So that's what you're thinking of. When you see beta 1,3,1,6-D glucan, that just tells you how the glucose molecules attach to each other. That's all that is. But that's very important because that's what determines whether it becomes immunoactive or whether you just digest it like other sugars and starches. So how those glucoses are hooked together is the real key to the function. Now, there's kind of interesting how beta glucan works. It's sort of like what you would call an immune adjuvant. Now, let me explain what that is. And a lot of people say it's not really an adjuvant, but it sort of really is. Adjuvants were discovered in the early days of vaccines. Now, I'm not making a pitch here for using vaccines necessarily at all. But what they discovered was kind of interesting. One batch would be much more potent than another. And they couldn't quite figure out why for a while. And they finally decided that they must have contaminants in the vaccines that were causing them to be ineffective. And that's what they thought. But actually they turned out that the contaminants were what were making the ones that were effective more effective. So that was kind of a surprise finding, that the contamination made it more effective. And that's because certain molecules and substances can interact with immune cells and make them become more active against the target molecule. In this case, whatever the vaccine was targeting. If it was polio virus, the deactivated ones, then it made it have a stronger immune reaction against the polio virus. Nowadays, they put adjuvants in vaccines just for that reason, to increase their activity. However, they don't use the beta 1,3,1,6 in vaccines, the D glucans. I've never seen it in an injectable form. It might be, but they use aluminum compounds a lot in vaccines as adjuvants. So that's kind of the history of where adjuvants came from. But beta glucan works that same way. It doesn't activate the immune cells. What it does is make them sort of primed and ready so that when they contact something that's an antigen that they need to fight against, they're already ready to go and they're more active more quickly against it. So if you don't have any viruses, any bacteria, anything like that, and you take beta glucan, it's probably not going to do anything for you, actually, because there's nothing to target. It's not going to stimulate your immune system to just go off the wall and start doing stuff. But it's more ready for those things when they do come along, the viruses and the bacteria and things like that. So that's how, in a nutshell, how beta glucan works. Now, Dr. Cox in a little bit will go into it a little bit more detail, but that gives you a good starting point. Now, the immune system is a huge system throughout the body, and you can see by looking at this chart that it's located in everywhere from the tonsils and adenoids to bones. The appendix has a lot of immune activity. Lymph nodes, the thymus is where T cells are differentiated to quite an extent, but all through there, a really key place, and it's not highlighted on here, but to me one of the most important places is in the intestinal tract, the gut. The gut has these Peyer's patches with M cells in them, and this is where beta glucan really gets started working. It binds to the M cells in the lining of the intestinal tract, probably the small intestine mostly, but there it can take the signal from whatever it's binding to and transmit it to circulating cells inside the body. Now, it's kind of interesting that how it works, and I don't know that we completely understand it, but apparently these things that go all the way even from the mouth. Interesting story. When I was in Knoxville, I had a health food store, and there was a woman that was a customer whose child was severely allergic to wheat, just as allergic as what you see with peanut allergies sometimes. And these allergies can happen viciously and quickly with somebody with a severe allergy. And her son was so allergic to wheat that if he put a cracker in his mouth and bit it, he would be going into anaphylactic shock almost immediately. It didn't have to swallow it, didn't have to circulate in the bloodstream, anything. It already contacted some of these immune cells in the intestinal, gastrointestinal system, which starts with the mouth, and was taking a systemic action that quickly. So you can see that the gut immune system is really, can be quite profound in its effects. Now, with that having said, I think we'll move on and listen to Dr. Cox's presentation, and that'll be the main part of what we do today. So, with that said, let's get started with Dr. Cox.
Beta glucan is becoming more and more recognized as a valuable tool for support of the immune system. Studies have been conducted on both animals and humans. The research is plentiful, and the MOA, or mechanism of action, is well defined, and its effectiveness and safety are well documented. As we learn more and more about our health, nutrition, and beta glucan's role in supporting the vitality of the immune system, scientists have extended their research to children. Today we will meet Dr. Donald Cox, a 13-year veteran of clinical research with beta glucan, and discuss some past studies with yeast beta glucan and the amazing results. He will detail 3 substantive trials that have been conducted with children. Beta glucan's excellent safety record and its rating by the FDA as GRAS, or generally recognized as safe, has led to an increased desire to find more areas of use and benefit. These 3 studies involve more than 700 children in double-blind research in countries scattered across the globe. They look at acute respiratory infections, allergies, and overall health and recovery from a wide range of illnesses. The results in all 3 studies are consistent and significant. Beta glucan gives proven immune support to children, and it's safe. Yeast beta glucan has so much potential, not only for cancer patients, but for healthy individuals who want to maintain and improve that health. Our children are our future. Their health is in our hands, and in the hands of the researchers. Pay attention today and every day for ways that you can improve your life and the lives of your families. Now, let's meet Dr. Cox. Dr. Cox, thanks so much for being with us here on the immune response. I've read through your CV and it's quite impressive. Tell us a little bit about your involvement with beta glucan and what you've been up to the last few years.
Sure. Well, I've been working with the yeast beta glucan for about 13 years. Started off early on developing the clinical research program. So, of course, we started looking at the ingredient in a range of adult populations, looking at the safety and efficacy of the ingredient. And over the last few years, we've really been focusing more on more unique populations. For example, today we'll talk a little bit about some of the children's studies that we've done and how the yeast beta glucan helps to
If you want to just jump into that, and then we'll follow up with questions as you go along.
So I thought I'd start with a little introduction, telling you a little bit about what makes the yeast beta glucan unique and what drives us to have an interest, an ongoing research interest in the ingredient. And then we're going to step into some studies, some specific studies on children, focusing on how the yeast beta glucan helps to maintain the overall immune health of the children. So there are a few things that make us very, I guess the word would be proud of the science, the state of the science behind the yeast beta glucan. Among other things, we have a very well-defined mechanism of action. We have a significant portfolio of clinical research now demonstrating the efficacy, how well it helps to support the health of people, and also a very strong safety profile, because this ingredient, like a lot of ingredients that we use in foods and supplements nowadays, gets taken on a daily basis. We call that chronic consumption, so you have to demonstrate safety, and I like to highlight the safety of this particular ingredient, the yeast beta glucan, as we proceed. So let's start with a little bit of the description on the mechanism of action. So in this one slide, I'm going to summarize about 30 years of research and quite a number of peer-reviewed publications in leading scientific journals. For example, in this slide, we're paraphrasing some results from the research published in 2004 by Hong et al. In the Journal of Immunology. We understand how the product works, how it gets into your gastrointestinal tract, and what it does there. When it's consumed orally, the yeast beta glucan makes its way into your small intestine, and there's some immune tissue there called gut-associated lymphoid tissue. And the beta glucan particles are actively picked up by immune cells there called M cells in a region called Peyer's patches. And they get transferred across the epithelial region and into your circulatory system, so your blood, your lymph, and there are immune cells there. Primarily, the ones we're interested in for today's talk are macrophage cells, monocytes and macrophages. And they actually pick up, they digest, consume or eat, a process called phagocytosis. They eat the beta glucan and then circulate throughout the body and make their way into various immune organs. These could be your lymph, these could be your bone marrow, etc. And once they're in these organs, they begin to break down over a period of a couple of days. And the yeast beta glucan, when it breaks down, forms a bioactive fragment, and this fragment is actually released by the macrophage cell and is picked up by other immune cells called neutrophils, primarily. And neutrophils are important because they're a very abundant immune cell in the body. And perhaps the most important takeaway from this slide is that when the neutrophil has the beta glucan, the yeast beta glucan on the surface, it actually changes how the neutrophil responds to its environment in two key ways. It changes how the neutrophil migrates, a process called chemotaxis, kind of a navigation system, and it allows the yeast beta glucan containing neutrophil to more easily find its way towards a non-self cell. And when it encounters a non-self cell, it knows what to do with that cell. A non-self cell is anything that doesn't belong in your body, something that's not a natural component of your body. And once the neutrophil with the yeast beta glucan on the surface encounters that cell, it helps to remove that cell from the body. So that's a quick summary of the mechanism of action. So let's, if we're okay to keep rolling here.
Sure, absolutely.
We'll just talk a little bit about some of the...
You have the floor, sir.
All right, some of the consistent clinical results. We have a significant portfolio of research. We've been doing research on the beta glucan, the yeast beta glucan now for about 13 years or so. And we've pretty consistently demonstrating that it helps to maintain and improve a person's overall physical health. And this can be during periods of challenge. So for example, we all need a stronger immune system, a healthier immune system during the cold and flu season, which ranges typically from September, October till about April or so where I live. And taking the yeast beta glucan helps to maintain your overall physical health, helps to prevent you from encountering or from your lack of ability to handle encounters that occur every day. So every day we're all bombarded with various health challenges. Your immune system normally handles those fairly well. The yeast beta glucan helps you to handle them even better. So it definitely helps to support the immune system. Over the years, we've done a range of clinical studies. We've typically, in our early days, did studies with always a normal, healthy population. But to start with, we did a adult population. So we looked at lifestyle stress. We looked at physical stress. Under physical stress, we've done a number of clinical studies looking at marathon runners. So we know from research that post-race marathon runners are more susceptible to upper respiratory tract infections, for example. And including the yeast beta glucan in their diet helped to reduce the incidence of these upper respiratory tract infection symptoms post-race. We found that we did that first one back in, I think, around probably 2007, 2008. We followed it up in 2011 with a second marathon, a larger marathon study, and we saw similar results. And we've continued to explore the benefits of the yeast beta glucan on any form of exercise, physical stress-induced stress, including looking at various immune biomarker responses against exercise-induced stress. Because believe it or not, we know that when we exercise, we're generally healthier. But if you over-exercise, overexert yourself, you can actually temporarily suppress your immune system, which opens the window, the opportunity for challenges, for potential health challenges, including the beta glucan in a regimen and in the diet for people that overexert themselves, perhaps high-performance athletes or just the weekend warrior that tends to overdo it. really helps to maintain the health of the people long term during the exercise and during the post recovery period that occurs during exercise.
Talking about these athletes, would the doping testing that they do, would that ever be an issue with beta glucan? Would that show up, or would it be something that they would be dealing with?
I understand. No, the yeast beta glucan has been cleared by informed choice and informed sport, so we know that it's an ingredient that does not violate any of the WADA, the World Anti-Doping Agency, criteria for supplements. So it's a very safe ingredient for use by athletes as well.
Well, the other thing that I was just going to ask you, you've stressed yeast beta glucan. Have you done studies with the other glucans that come from other materials, mushroom or oats or that kind of thing?
We've done some. There's a preclinical study, which means an animal study typically, published back in 2009, where we compared the yeast beta glucan against various sources of mushroom beta glucan. And it was a mouse survival study, and we actually looked at the survivability of the animals when taking the beta glucan and the different forms of beta glucan, and the yeast beta glucan was by far at least double, if not more, superior in terms of the survivability of the animals long term versus the mushroom glucans. So there is some published research out there, and we can do some additional research as well.
Okay, didn't mean to derail your train of thought there,
but okay. So just getting back to some of the discussion on some of the clinical studies, we also have a lot of lifestyle stress studies. Lifestyle stress, for example, thinking of some of the populations we worked with, might be just people who are under high stress because of excessive travel, long hours working, etc., or career choices. We have one study where we looked at medical students, fourth-year medical students, and we demonstrated that consuming the yeast beta glucan over a 90-day period helped to maintain the health and wellness of these medical students. And of course, this was all medically verified in that study. We've also done we have one published study where we looked at just women. This was another 90-day study. We had 90 women in the study, and we showed that women taking the product tended to be healthier over the course of the study than people taking the placebo. And by the way, it is important to say that all of these studies are randomized, double-blind, placebo-controlled. These are all the gold standard study. More recently, we've been focusing on more unique populations. So for example, we've done some studies with some what we'll call healthy aging, just people that are normal aging people. And we've also done a number of studies now with children, 3 separate studies with children, and we'll talk a little bit about those studies in particular today.
Good.
So one area that I like to highlight a little bit is just talking about the safety data. As I said earlier, these products, a lot of health ingredients that are used in supplements or other products, are taken continually, so taken chronically, that is day in and day out, and you want to make sure that these ingredients are safe. With the yeast beta glucan, we published the safety data back in 2007 and have done a number of toxicology studies to demonstrate the safety of the ingredient, both for what we call subchronic or even chronic consumption, acute consumption, which is when somebody takes a very high dose at one time to make sure that it's safe. And we've also demonstrated and, of course, maintained observations of safety throughout all of the human clinical studies. So it's a very safe ingredient.
A question that probably comes up with our viewers with respect to safety is that of interaction with either other supplements or medications they may be on, those kind of things.
Right. We haven't had any reports of any unsafe interactions with the yeast beta glucan that we're aware of. So if people ever have a concern, we always suggest to them that they speak to their healthcare professional. That's just a good thing to do if you have any area of concern, if you have a particular health condition or status, you definitely want to just check with your healthcare professional.
Well, do you know whether or not the FDA has a position on the safety of this compound? Or?
With the yeast beta glucan back in 2007 and 2008, we went through the process called generally recognized as safe, where we, of course, we put a panel of experts together, medical doctors, toxicologists, to review the safety data that we had on the ingredient. We also took the second optional step, which was to send our data in to the FDA for review, and they responded that they had no objections at that time. And to date, of course, still no concerns, but they had no objections to the data on the yeast beta glucan. All right. Well, let's roll through and begin to talk a little bit about some of the studies. In particular, today we wanted to focus on the children's studies. So I'm going to talk about 3 studies in particular. The first one had 310 children. These were 3 to 4-year-old children. This study was done in Beijing, China. And it was children consuming a milk-based beverage that contained the yeast beta glucan and other ingredients, or just a milk. So the milk was the perfect placebo to use in this, the control product. And we'll talk about that one first. The second study was with 256 children. That was done here in the Americas, in South America. And it was with children, again, consuming a milk-based beverage that contained several ingredients, one of which was the yeast beta glucan. And we looked at a range of what we'll call allergic manifestations or allergic events. So this could be typical airborne allergies or skin-based allergies like eczema. And again, it was versus a milk control product. And then the final study that we'll talk about today was with just the yeast beta glucan alone in a water-based beverage. We actually had a sachet with just a little sweetener added to it that was added to water, mixed, and the children consumed it. These were 1 to 4-year-old children. And they had either what we'll call the placebo, which was the sweetened water by itself, or they had the water-based beverage with the yeast beta glucan alone. So let's start talking about some of these studies. So the first study here is a fairly lengthy study, 310 children, 3 to 4 years of age. It's 28 weeks, so roughly 7 months long. Randomized, double-blind, placebo-controlled, and this formula contained the yeast beta-glucan, some prebiotic fibers, and the milk as the control. And in this study, we showed that the multi-component formula containing the yeast beta-glucan, that the children had fewer acute respiratory infections. And the way to read this particular slide, I can see that it's just a little bit can be confusing for people. But we're looking at the number of respiratory infectious episodes that the children had versus the placebo. So taking the multi-component formula or the placebo, and we see that more children had 0 infectious events when they were in the yeast beta-glucan containing milk-based formula versus the control of milk only. And then when you look at it and you read across that table and you see, well, how many children had 1, 2, or 3 respiratory infection episodes, you'll see that they had fewer of these episodes when they had the milk component formula, when they had the multi-component formula containing the yeast beta-glucan versus the milk alone. So they remained healthier during the course of the study, and that was statistically significant. Now, children do get ill. They do get colds. I think all of us are familiar with that have children, and sometimes these illnesses come on quite quickly. So during the course of this study, which was roughly 7 months long, when children did get any kind of an acute respiratory infection, the duration of that illness was shorter, almost by a day, for the multi-component formula, milk formula containing the yeast beta-glucan versus the control of milk. You'll see 3.5 days on average for the yeast beta-glucan containing milk formula group versus the milk alone group, where it was 4.3 days in length. Finally, an important measure for children is how often they're able to attend their daycare or their school. Obviously, if a child is sick, that impacts the entire family. Somebody has to stay home and take care of the child, and we all do that, of course. But with a healthy child, they can go to daycare, they can go to school. And you'll see here a similar layout to that first slide that I showed, that the children had fewer missed days on average when they had the milk-based formula containing the yeast beta-glucan versus when they had the control of milk alone. And you can see, if you read across that table, the children that had 0 episodes of missed days was higher for the milk containing the yeast beta-glucan versus the control. And also for those that missed 2, 3, 4 or more days, you'll see that it was significantly lower, and that was statistically significant.
So has anyone tried to quantify the financial impact of lost days at school and those kind of things? Has that been something you've
There might be something in the publication on that, but I don't particularly remember that event, if they calculate that or not. But obviously it would have an impact there.
What effect does the second ingredient in the cocktail that you used have, irrespective of the beta glucan?
Sure. The second ingredient is a group of prebiotic fibers that were included, and their role is to help to maintain the digestive tract health, the gastrointestinal tract. And there's a lot of research out there showing that these ingredients do have a beneficial effect on the digestive health of people in general and children in particular.
Okay.
So let's roll on and talk a little bit about our second study here. This one had 256 children, 1 to 4 years of age, and it was in a daycare setting. This particular study was done in Brazil. It was 28 weeks in length, roughly 7 months, and it was again randomized, double-blind, placebo-controlled. It contained the same composition as the last study, a multi-component formula that had the yeast beta glucan, the prebiotic fibers, and DHA. And this was versus a control of milk. And interestingly, this product in both of these studies was provided for the children 3 times per day. So over the course of 3 consumptions of this product, they got the entire dose of the healthful ingredients that were included. So let's talk just a little bit about this study. So what we will refer to as the formula-fed group, you'll see it as FF here on the slide. You can see that they had fewer episodes of what we'll call allergy-related conditions. So these might be pollen-based allergies. They could also be eczema or urticaria, which are skin-based allergies. And you'll see that the children that consumed the milk product having the additional healthful ingredients, the yeast beta glucan, the prebiotic fibers and such, had fewer episodes of these allergic events versus the control of milk. Now, milk by itself is obviously a very healthful ingredient or healthful food for children. Adding the yeast beta glucan and the other ingredients to the milk, as we can see here, has added benefits. And this was a statistically significant outcome showing that it had a lower overall hazard ratio for having these allergic events, which just means a lower incidence of the typical allergic events. So with that, I'm going to move on to our third study now, and we're going to talk about a study with a 12-week study, so roughly 3 months. This study had 156 children aged 1 to 4 years of age, and again is a randomized, double-blind, placebo-controlled study. The primary outcome for this study was for a pediatrician to observe the health of the children after consuming the yeast beta glucan. And this study had the yeast beta glucan added to a sweetened water product, and so there was only either the sweetened water as the placebo, and it was just pure cane sugar solids that were added to the water, or that same composition plus the yeast beta glucan. And we're looking at observing the overall health of the children during the course of the 3 months. The secondary outcomes here was to look at the typical range of illnesses that children get. So these would be your typical upper respiratory tract infections, but also any other common illness that a child would get, because they don't only get colds, they don't only get respiratory infections, they'll get conjunctivitis, obviously commonly known as pink eye. They get ear infections, they get strep throat, a range of illnesses. So we had the pediatrician observe the outcomes for any of these other common ailments for young children as well. So the children either received the placebo, which was just the water-based beverage with a little sweetener, or they consumed the yeast beta glucan. And they had it at either 75 milligrams per day or 35 milligrams per day. And the study was conducted at a hospital daycare center, and all of the symptoms that the children had anytime they felt any kind of an illness, that obviously the parents would report this to the pediatrician, and the pediatrician would examine the children during the course of the study. So overall in this study, children taking the yeast beta glucan water-based beverage were significantly healthier. 62% of the children consuming the water-based beverage that had the yeast beta glucan in the product remained healthy during the entire 90-day study, so they didn't get any illnesses, whereas only 15% of the control group remained healthy. Put another way, 85% of the children in the control group had some kind of ailment during the course of the study, and less than 40% of the children in the yeast beta glucan group had any kind of an illness. as we said in the, early on, no matter what you do, children are periodically going to get some kind of ailment. That's kind of what they do. The
Especially
children,
in close quarters with a lot of others.
yes, they do. They're all playing
share them.
and touching each other, sharing toys and other implements. So I think that's just having a strong immune system helps to reduce the frequency of ailments with those children. But they do occasionally get sick. Using this slide, we can see that the children taking the yeast beta glucan had 2/3 fewer upper respiratory tract infections during the course of the study. So on average, the control group had, and I'm going to round off here, the children in the control group had about 1.5 illnesses per child, whereas in the 35 milligram group, so they only had 0.5 on average respiratory tract infections during the course of the study. So they had only 1/3 as many illnesses as did the group taking the control product alone. The yeast beta glucan had other effects. So in terms of the number of days where the children were ill, children on average in this study in the control group had roughly 9 days where they had respiratory tract infection symptoms during the course of the study. It was only roughly 3 days for the children in the 35 milligram group. So overall, the children remained significantly healthier in this study for those that consumed the yeast beta glucan, and that's consistent across all 3 studies. The first 2 studies had a multi-component formula that contained the yeast beta glucan, and the third study here had only the yeast beta glucan ingredient, showing that the immune response, the immune health that the children, that we observed with the children was likely due to the yeast beta glucan. So summarizing what we've spoken about today, the yeast beta glucan provides proven immune support for children. We have a science-based ingredient, a well-defined mechanism of action. It's an ingredient where we know that when people are consuming it, we know what it should be doing. We have a very good understanding of how it works. That's through many years of research. Published safety data. The safety data is very strong and clinically supported immune health benefits. So we've done our homework over the years doing clinical research with this ingredient. And obviously we did many studies in adults before we decided to do any studies with children. And children in particular will benefit from taking the yeast beta glucan. According to the data that we've shown today, it reduces the incidence of respiratory infections. It helps to lead to shorter duration of colds for children when they do get ill. And one of the benefits there, an economic benefit as you pointed out earlier, is that the children will have fewer missed days of school or daycare, which means less of an economic impact on the family.
Very good. Well, I know everybody's concerned about their children being healthy, and hopefully the result of the work that you've done, the studies you've done, will lead to some products coming down the pike that we can use within the market to help children maintain healthy immune systems. That's very important and very exciting. Thank you so much for being with us here on the immune response, and hopefully we'll be able to talk to you again sometime real soon.
Thank you very much.
Okay, I think that was a great presentation by Dr. Cox, and I hope you enjoyed it. Actually, he was talking about hopefully some products would come down the pipe. Well, and about 2 months after we taped that, his and my presentation, we had Beta Kids. Not surprising. This is a beta glucan product, also contains selenium and vitamin D3, and it's a gummy type product. Now, some of you may worry a little bit about does beta glucan last long? I mean, is it stable? Actually, beta glucan is about as stable of a molecule as you can imagine, fortunately. This stuff will be around for years if you leave it on your kitchen cabinet shelf. The way they make beta glucan is to actually take the yeast and do a strong acid hydrolysis with it, neutralize it, and then do a real strong alkaline treatment. And, you know, it's been through an unbelievable amount of abuse by the time they get there, but all that's left, they've gotten rid of all the proteins, the fats, and all that in that process, and have gotten down to the beta glucan part. Then with this yeast beta glucan, it's not exactly the same as everybody else's on the market. A.J. Lanigan, who we work with and worked with producing this product, and some others, has done research, and he's funded the research that was here and a lot of other research on beta glucan, but has taken a false fraction of the beta glucan itself that's just the right size to bind with those M cells that he talked about. So the yeast beta glucan that we use is the best, period. It's one that has by far the most research. It's been heavily researched. It's been in very prominent scientific journals. So this is a product that we know about as sure as you can know anything that it works. There's always caveats in research, and we're always learning more, but this has got a ton of research behind it. Now the Beta Kids, if you're looking at this on YouTube, on our YouTube channel, there's also kind of a very quick little video that explains Beta Kids in a more amusing and funny way. Let me put it like that. I think you would really enjoy it. And if you're a store, you can actually take our Beta Kids brochure and look on the back, and you can link right to that video and show people right in your store that little video. So it's a great product, and of course this is the time of year you want to start thinking about immune support for your children. We also have other products that are beneficial for the immune system. We have beta-1,3-D glucan itself. We don't use the strongest out there. Ours is 100 milligram, but it's actually enough to be fairly strong. If you want more, maybe 2 of those a day. Some people are selling up to 500 milligrams. I don't think for most people that's necessary. If you remember, I talked about how these cells in the body, just a little bit of a wheat cracker in the mouth would set off anaphylaxis. Well, immune cells can act on very small amounts of things. In fact, they usually do. And so I don't think it's necessary to have a huge amount of beta glucan. Now, I will say that a lot of times people question, and I have too, is beta glucan, if it sort of potentiates the immune system, is it safe for people with allergies? Well, we just saw that second study that it actually helped people with allergies. So that's an improper immune response that it actually suppressed in that study. Also, how about people with autoimmune diseases, multiple sclerosis and things like that? The research isn't as strong there. However, the indication so far with the research is that it really changes how the immune system works. There's different branches of the immune system, and it kind of shifts it away from that particular type of response, as best we can tell. Now, with somebody with severe autoimmune diseases, I would approach it cautiously. I'd approach anything cautiously with those kind of people, especially something like colitis, ulcerative colitis, and Crohn's disease. They might try a little while and see, but I'd be really cautious with those people if I tried them on anything, because they can have a life-threatening reaction to almost anything. The worst thing that I've seen with those actually is milk. Milk can be devastating to people with those inflammatory bowel diseases. But nevertheless, be cautious with people like that. Don't assume that it's going to work well. We think it probably would, but I wouldn't make that assumption. Now, we also have some other products that really do help the immune system, or various parts of it. Our EasyFlex product helps suppress the inflammatory reactions that you have in joints and knees and arthritis. It's a wonderful product. It really is. And it's got things like boswellia and curcumin, cayenne and ginger. It attacks the pain and inflammation from a number of different vantage points. and is highly effective. We've got Livovite. Now, you don't think so much of liver as being a immune organ, but it actually is. All through the liver, where the blood travels, are what they call Kupffer cells. They're actually resident macrophages in the liver that can locate and help destroy toxins that make it in the bloodstream. So the liver actually is a fairly important organ for the immune system. Just a few more things. We have the milk colostrum. It's kind of an interesting thing. It comes from range-fed cows in Wyoming. It's the very first milking of the cows before really milk. It's an immune supplement essentially for the baby cows, but it has a lot of different immune factors in it. And this can be something pretty good for a lot of people, and I would encourage you to learn a little bit more about it. It has fats, it has glycoproteins, a lot of different things that can help with the immunity. B12 is actually very important for the immune system because immune cells have to make these molecules called cytokines, and B12 is important in that process. And our B12 has the two activated forms, the methylcobalamin and the adenylyl, cobalamin, the cobamamide form. So it's the best B12 I've seen, to be honest. Vitamin D3 is an important regulatory molecule. We put it in the beta kids, and we know that it is, absolutely essential for good immune health. Echinacea also is an immune herb that we know works a little bit like the beta glucan does in helping to potentiate the immune response. So there's a number of other things too that really work well with the immune system. These are the ones I wanted to point out. Now, with that, I'll stop for today. If anyone has questions, I'll be happy to try to answer them. Any questions on the topics we talked about today? If not, we'll see you next month, and have a wonderful evening or day, whatever the case may be for you. Thank you for coming.